Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs.
Sounds good. Thank you, Lauren, and thank you all for being here today. As you know by signing up, what we're talking about is healthy weight loss, but specifically in the context of cancer survivorship, although this could really apply to, a lot of folks. So hopefully you'll get some good information out of this. Okay, so a couple things we're going to go over today. To start with, we're going to talk about the role of weight in cancer. So establish the relationship between the two. We're going to understand some basic principles of weight loss, and then practically put those principles into place using a balanced plate. Okay, so let's start off and talk about the relationship between body weight and cancer. So, interestingly enough, the American Institute of Cancer Research recommends, in order to prevent cancer, their number one recommendation is to maintain a healthy body weight. And this is because we've actually identified weight loss or weight management as the second leading cause, or excuse me, second modifiable risk factor for cancer outside of smoking. So avoiding tobacco products would be number one, and maintaining a healthy body weight would be number two. But unfortunately, we know that about 40% of Americans fall into the obesity category, and about 70% are either overweight or obese. Back in 2014, they estimated that almost 11% of cancer cases in women and almost 5% in men could be directly related to having excess body fat. So we'll see here in this picture that several different cancer types are at increased risk based on having a higher body fat. So the most common cancers, postmenopausal breast cancer, we've got prostate cancer and colorectal cancer, which those are the three top cancers in the US outside of skin cancer. Those are all directly related to overweight and obesity. The good news is research suggests that if you have a higher body weight and you're able to lose weight, that can actually decrease the risk of some cancers. The Women's Healthy Eating and Living Survey took a look at this and saw decreased risk of both breast and endometrial cancers with some weight loss. So how do we establish our weight status? We typically, in healthcare settings, use the BMI calculator, which really takes a calculation of your weight and your height and comes up with a number to put you either in underweight for your age, normal, overweight, or obesity status. This is never perfect, but it is kind of a quick and fast, inexpensive. You don't have to go anywhere. You don't have to do any tests to see where you might fall in the weight status compared to your peers of your same height. There's a lot of BMI calculators on the internet. I believe the American Institute of Cancer Research even has one available. So to cover some basic weight loss principles, most of us have probably heard that weight loss is all about how many calories you bring in or eat versus how many calories you're burning or are sending out. But really, weight loss is a bit more complicated than just burning more calories than you're eating, which would be what we call a calorie deficit. When it comes to cancer survivorship, this relationship gets a whole lot more complicated. So it's not quite this simple. We know that our metabolism can be affected by a lot of different factors. Age is one, medications, hormone therapy that we might be on, and those can all affect how quickly our body is willing to burn calories. Other things like inflammation, stress levels, where you're at in your female hormone cycle. Are you peri, post menopause? Are you premenopause? All of these things can make weight loss a lot more complicated. What we find is that eating too few calories can actually slow down your metabolism and keep your body in fat storing mode. So when I talk to a lot of my patients and we go through a typical day of eating for them, I might even see that they're skipping meals. Maybe they don't have much appetite after cancer treatment, or maybe their portions are really, really small for what their body needs, yet they're not losing weight. In some instances, based on things like their hormones or their medications, they might even be gaining weight. So, how we get out of this fat storing mode is by doing what we can to support our metabolism, to speed it back up, give it the nutrition that it needs, and then help it to feel calm and stable enough to go back in to fat burning mode. So, how do we do this? I first start by looking at meal timing. This is important whether you're in fat storing mode or maybe you're just at the beginning stage of your weight loss journey and you're not having any difficulty with your metabolism. So meal timing is important. What we recommend is for most individuals to kickstart their metabolism by eating breakfast within 30 to 90 minutes of waking up. This helps to kind of set your hormone, your hunger and your fullness hormones for the day. It also kind of tells your body, okay, we're going to get the energy that we need for the day. So it's okay to burn a little bit of the excess calories. From here, you have two pathways. We can either do the traditional 3 meals a day with snacks as needed in between. This works for most people that I work with. It helps you to stay satisfied and prevent you from having to eat all day and really listen to your hunger and fullness cues. On the other hand, some people do prefer more frequent meals. This might especially be true for any cancer survivors who are having any other side effects, maybe delayed gastric emptying, meaning you get full really quickly. Maybe if you're dealing with nausea, maybe if you have really low energy, sometimes eating more frequently can help support your energy levels. So this would look like spacing your meals evenly throughout the day. You'd still start 30 to 90 minutes after waking up, and then you'd probably be eating a small meal or a snack every 2 to 3 hours. So you can kind of take your pick here. What you will notice is I'm not including intermittent fasting on this. The reason being, when it comes to weight loss, there are some people who do benefit from intermittent fasting, but in my experience, working with hundreds of patients on weight loss, it's a very, very small percent of people who can sustainably lose weight while fasting. Typically, especially for women, and especially for women peri and post-menopause, doing an intermittent style fasting, meaning going more than 13 hours a day without eating, usually the overnight period, can actually increase your sugar cravings, lower your energy levels, create imbalances in your blood glucose, and keep your body in that fat storing mode as opposed to fat burning mode. So usually that's not where we like to start. Of course, you can always individualize based on your body. So a couple tips for your meal timing. Consistency is really important. We want to aim to eat at similar times every day to help our body adapt and kind of anticipate when food is going to be introduced or energy. You can also personalize, experiment with different strategies to see what's going to work best for your body, your energy levels, maybe your blood glucose. Maybe a healthy bedtime snack is appropriate for you if you frequently wake up hungry. Um, or, maybe if you find that you're very nauseous in the morning when you wake up, you might need something very small to settle your stomach at first, and then have a slightly more well-rounded breakfast. At the end of the day, we could have the perfect meal timing for our body. But of course, the foods that we put on our plate at these times is also really important. We want to focus on quality over quantity. So, nutrient dense, primarily whole foods to really maximize the benefits of meal timing. So again, there's no one size fits all approach, but if you're getting started or you want to reset your metabolism, usually 3 meals a day with snacks as needed, or smaller meals more frequently is where I would recommend starting. Okay, so let's talk about quality and quantity. We are going to really use the plate method to kind of walk us through what our plate should look like for optimal weight loss. And this is mostly going to be assuming the traditional 3 meals a day, because that is what most people tend to gravitate towards. So the plate method is this picture here on the left. It's a great tool to help you divide your plate into sections so that we're keeping each portion of the food groups to an appropriate quantity to support weight loss. So we're not letting one food group override the others. We're going to start by dividing our plate in half. One half of the plate we want to be non-starchy vegetables, which we'll go through each of these food groups one by one and give examples in every category. But for now, most of your colorful vegetables will fall into the non-starchy category. So you have a lot of options. Now, the other half of the plate, we want to divide evenly between a lean protein source and a high fiber carbohydrate. Lean protein is going to be either some lean animals like our poultry, our fish, could be animal products like dairy, eggs, or you could also use your plant-based proteins like tofu, legumes, as well. In your grains and starches or carbohydrate section, this is where you could either do your traditional grains or you could do your starchy vegetables. And then in addition, we want to potentially add either a serving of fruit or a serving of dairy. If we have higher energy needs, maybe we need both. We also want to make sure that we're not adding sneaky calories through our beverages. So we want to choose a low calorie drink like water, maybe an herbal tea, maybe decaffeinated coffee, things of that nature. So let's look at these components one by one. We're going to start with fruits and vegetables. We know that a diet rich in fruits and vegetables is linked to a lot of health benefits beyond just weight management. It can help lower blood pressure or reduce heart disease. It's linked with better, vision, fewer eye problems, as well as fewer digestive problems. It can have a positive impact on blood sugar, which can also help to keep our appetite in check. And of course, our fruits and vegetables are linked with reduced cancer risk and recurrence. So again, the American Institute of Cancer Research really wants us to prioritize our fruits and veggies. So let's look at fruit. We want to aim for a variety of fruit in the diet if you like a variety. If there's only one or two fruits that you like, that's okay. We'll just start with those and hope that one day maybe we can build upon that. Getting a variety will help you get a lot of different micronutrients as well as phytonutrients. So things that are really cancer fighting, like our antioxidants, and other polyphenols and phytonutrients. When possible, we want to prioritize fresh or frozen fruits, but we can use some canned fruits if we need to. Maybe it's easier on our digestion if we're having any lingering side effects after cancer treatment, or if we don't live close to a grocery store and our fruit goes bad quicker. But we want to make sure our canned fruit is packed in either water or only 100% fruit juice, no added sugar or syrups. It's also a great side snack, or if you want to have something sweet after a meal, but you're trying to minimize added sugars, fruit makes a great option. The American Institute again recommends that we get 2 or more servings of fruits daily. And a serving would either be half of a cup, so maybe half a cup of berries, half a cup of chopped melon, or a small whole piece of fruit like an orange or an apple. Now, to look at vegetables, we recommend filling half of your plate with non-starchy vegetables. This is largely because our veggies are very rich in fiber, which can actually slow down digestion, but while also promoting healthy bowel movements, feeds the good bacteria in our gut, and ultimately helps us to feel fuller longer. You have a lot of options, like I said, of your veggies. Any of your leafy greens, any of your cruciferous vegetables like broccoli, cabbage, kale, cauliflower, Brussels, or some other ones like zucchini, yellow squash, bell pepper, onions. All of those are great options. It doesn't really matter how you cook them. If you want them roasted, if you want them raw, like in a salad, all of those are great options. A serving size is either 1 cup raw or half a cup cooked. So when you cook it down, you will, lose a little bit of water, but you're going to maintain some of those vitamins and minerals. So it's going to be a smaller portion size. Eating more fruits and vegetables is something that almost everyone could benefit from. So we've come up with a couple of tips to help increase fruits and veggies if it's not naturally something you're drawn to. So number one, we recommend keeping your fruit or your vegetables where you can see it and where it's easy to grab. So maybe placing ready to go pre-washed fruits into a bowl, or even putting them in individual containers so you can grab it and go. We also recommend exploring the produce aisle and trying something new. So make it a little bit fun, maybe a challenge for you. Getting a good variety and color are really key to our body being able to fight cancer. All of those different phytonutrients and antioxidants are going to differ from one vegetable and fruit to the next. So that's why we really like to recommend switching it up, maybe even eating seasonally. That way your options naturally switch up with the seasons. Our third tip is to skip the potatoes. You can have potatoes, of course, but we want to keep that to our carbohydrate portion of the plate. We don't want to count potatoes, corn, or green peas on our non-starchy portion of the plate. Choosing the non-starchy options are also going to help balance out your blood sugar if you're dealing with blood sugar spikes. Another option, if you're regularly eating something like a sandwich or even an omelet, maybe something you don't traditionally add vegetables to, think about how you can incorporate them into something that you're already eating. So sliced tomatoes, cucumber, dark leafy greens like spinach are great on a sandwich. Avocado is another great tip, or even adding just sliced bell peppers. So kind of make it your own little, pub sub or Subway at home. Utilize snack time to get your fruits and veggies. Choose raw snacks. I mean, again, cutting them up in advance is really helpful, or even buying a party platter where they're already washed and ready to go is a great option. And you can always pair it with a dip if that makes it a little bit more enticing. Hummus, guacamole, even a little bit of ranch can help you to get more of your veggies in. And lastly, doing a smoothie is a great way to get good bang for your buck in terms of your fruits and your vegetables. Especially in regards to your veggies. Dark leafy greens pair really well in a smoothie. Riced cauliflower is great. It just absorbs all the flavor of all the other fruits and other ingredients you're adding. And avocado can also help make your smoothies nice and creamy. So now let's talk about our grains. So a lot of folks automatically assume that we have to avoid carbohydrates for weight loss. Unfortunately, this is a little bit misleading. Carbohydrates themselves don't make us gain weight. The issue is when we choose low fiber carbohydrates, we tend to get more of a blood sugar spike that can lead to different processes in our body that might lead to weight gain. Or when the carbohydrate section on our plate gets too large, so when it goes beyond a quarter of the plate, oftentimes we're hungrier sooner afterwards, especially if it's a low fiber carb. And that can lead us to eating more. A lot of our plates that are really carb heavy also tend to be fat heavy as well. So if you think about, a big plate of pasta, you might also have a creamy sauce that could be adding a lot of calories. Or if you're doing a pizza, maybe there's a lot of oil, maybe a lot of cheese on the pizza, and that could also be adding up in calories. So what we want to do here is choose grains that are whole grains. These have also been linked to reduced cancer recurrence for breast cancer. So we want to try to incorporate whole grains where we can. Things like 100% whole wheat or whole grain bread and bread products like bagels, pasta, tortillas. Or you could do grains like wild rice, oatmeal, and quinoa. You can also choose whole grain snacks. Popcorn is a great one. That technically is a whole grain. Or you could try something like 100% whole wheat or rye crackers. And as far as grains go, a serving size is usually about 1/2 of a cup. Okay, next up is protein. And protein is kind of the poster child of the nutrition world right now. If you've been listening to any podcasts, reading any information about nutrition, it seems like almost everything that people are talking about right now is protein. And part of that reason is because protein, like fiber, also keeps us really full and satiated, which ultimately helps us cut back on our portions. It also helps keep our blood sugar balanced when we're pairing it with our carbohydrate. And it helps support muscle building. So if you're using building muscle as a means to lose weight, the adequate protein will help you reach your goals further or faster. So the animal-based protein we recommend, again, is going to be our lean animal products, our dairy products, or some of our plant-based options. So our plant-based proteins are going to include things like soy products, tofu, edamame, soy milk, all have protein in them. You could also do your legumes, beans, lentils, chickpeas, and regular peas can all be a good source of protein. Your nuts and seeds can also add some protein. Now, this is going to depend on what you're cooking or what you're preparing, but in general, a serving size is 1/2 of a cup. Nuts and seeds are going to be the main exception to this. A serving size of nuts and seeds is usually about 2 tablespoons. Now, we also want to make sure we're choosing fats that are going to support our goals when we're building our plate. So you'll notice on that plate method, there wasn't a specific spot for fat. The reason for this is most Americans are automatically getting enough fat or more fat than they actually need without trying, just through their traditional preparation methods or just with the foods that we gravitate towards. The fats that are going to be the most beneficial for us are going to be our unsaturated fats. These are typically going to come from our plant foods. We'll go over the exception to this in a moment, but they're going to include things like omega-3s and omega-6s. Your nuts and your seeds are a great option. Avocados and olives are another great option. And then your oils, olive oil and avocado oil, are going to be your best oils to use when cooking. Making sure that you have a serving of fat at most of your meals is really helpful as well because it can also make sure that you're full and satiated. So if you're following that plate method and you've got your non-starchy vegetables, maybe a little fruit, your protein, a carb, and you're still feeling hungry, a good thing to do is check if you have a good fat source at your meal. On the opposite side of things, we are going to want to limit our saturated and our trans fats. So these are fats that are typically found in our animal products or our ultra-processed foods. So things like high fat meat, poultry skin, bacon, and sausage, which we do recommend avoiding our bacon and our sausage as a cancer survivor because of their carcinogenic properties. Whole milk, heavy creams, butter, those can all be a source of saturated fat. Trans fats are more of a processed fat. We really want to avoid trans fats as much as possible. They're found in things like stick margarine, some fried foods, and some packaged foods. Although luckily we're starting to see a move away from trans fats in our packaged foods. Instead of using butter or stick margarine, what you could do is reduced fat, whipped, or liquid spreads. You could also use some of those oils. Again, things like olive oil on bread instead of butter, or cooking with olive or avocado oil instead of cooking with butter. So some healthy swaps for some of our fats with butter, which I always tell folks, butter does have some nutritional benefit. The problem is when we overdo it. So you don't have to get rid of it, from your diet completely. But if you find yourself using it multiple times a day, multiple meals or snacks, we will want to find some places to swap it out. So 2 tablespoons of butter can be replaced by 2 tablespoons of olive oil. Potato chips, which tend to be high in our saturated fats, can be swapped for popcorn for an equally crunchy and salty treat. Pretzels and peanut butter, not necessarily a bad snack, but pretzels usually aren't a high fiber option. So what would give us a little bit more of a hunger crushing combo would be apple and peanut butter. If you have a sweet tooth and you're snacking on gummies, maybe we swap to a 100% dried fruit rope. Our white crackers, like a Ritz, we could swap with ancient grain or another whole grain chip or cracker. Ice cream, we could swap with something like a Greek yogurt. Maybe we put a little honey, a little fruit on it for sweetness. Before we started this presentation, Lauren was asking about the Ninja Creamy. Some people are making their own homemade ice cream with a higher protein option like Greek yogurt. And then for a candy bar, maybe we do a couple pieces of dark chocolate with some nuts to get that fiber and healthy fat. Okay, let's talk about dairy. So dairy and their alternatives can be a great source of protein, calcium, and vitamin D. A lot of the recommendations suggest 2 to 3 servings of dairy per day. This is true for a lot of our survivors, especially if you've been on or are on any medications that may affect bone health. Dairy products and some dairy alternatives are the most bioavailable forms of calcium for your body. You may need to consider some fat-free or low-fat varieties, especially if you've identified that your diet has a lot of high-fat foods in it already. If you're lactose intolerant or you're avoiding dairy for another reason, you want to make sure any plant-based milks or lactose-free milks have the calcium fortified in them. It's also best to make sure that there's some protein in them. Typically, almond milk and oat milk are going to have very minimal protein, but something like a soy milk or maybe a lactose-free dairy milk will still have the protein. So a serving size is usually a cup of a milk or a yogurt, half a cup of cottage cheese, or 1 ounce of most other cheeses. Okay, so let's take a look at what this would be to make some swaps. So starting here, this would be a picture of a traditional American or Western meal. We've got a big portion of a red meat, and then at least half the plate, maybe more than half the plate, is comprised of starches. So these are two starchy vegetables. We've got our mashed potatoes and we've got green peas. We're also getting fat from both the red meat as well as the big hunk of butter that's on the mashed potatoes. Now, on the right here is a little bit more of a balanced plate. We've swapped to a lean meat for less saturated fat. We've got some chicken here. And then we're also using a higher fiber grain. So to help promote fullness and satiety and give us all of those great gut benefits, we're choosing what looks like a quinoa or maybe a quinoa and rice blend. So that's half the plate. The rest of our plate is full of different variety of our veggies. And we can maybe even assume they're using a healthy fat like an olive or an avocado oil to cook or roast these vegetables. So this is just breaking down the swaps and the foods on these two plates. But one thing I want to make note of is the plate on the left, a traditional American dinner plate, is 12 inches across in diameter. For weight management, we don't want to fill that 12-inch plate all the way to the brim. Usually a 9-inch dinner plate, or, kind of in between a salad and a regular dinner plate is more appropriate in terms of portion size. So speaking of portions, how much exactly should we be eating? This is going to be very individualized, and the goal today is not to give people specific calorie ranges. In fact, I don't love counting calories. It tends to focus on quantity as opposed to quality, which we've established the quality is important. And also, there's a high burnout rate with counting calories. Instead, we want to be able to listen to our body to determine when we're hungry and when we're full and eat based on our body's needs. So instead, some tips to help with portion size. Stick to your consistent meal timing, which we talked about earlier. Um, we can use a 9-inch plate, so maybe a little bit of a smaller plate. Also, eat slowly. It takes about 20 minutes after we start eating for our stomach to communicate to our brain that we're full and satiated. So if we eat really quickly, we might end up overeating because we're not giving our body enough time to tell us that we're satisfied. If you do decide after 20 minutes that you need a little bit more, maybe it wasn't enough fuel for you. We recommend going back and focusing on the protein or any of the high fiber portion of your plate to be satiated while making sure we're not overdoing it on calories. And lastly, check your hydration. If we're dehydrated, our body is more likely to signal that we're hungry, which could lead to overeating or over snacking. Okay, so when we're dining out, this is where it can get really challenging when we're not in control of what we're putting on our plate. I've concocted a couple of tips to help here. So the first tip is the first thing a server is going to ask you is, what do you want to drink? Make sure our beverage choice isn't working against our goal. Aim for watery or calorie-free beverages most often. Or if you need a little caffeine pick-me-up, maybe just make sure that they don't refill your drink and then swap to water. Choose baked or grilled as opposed to fried in order to keep your saturated fats down. And look for lean meat options. Maybe you really want a sandwich. Maybe instead of doing a burger, we could do a grilled chicken sandwich. Choose low-fat or oil-based salad dressings. Ask for them on the side. And also make sure that your sides are working for your goals as well. Maybe you know that your meal is going to be a little bit more of a splurge. Then make sure you choose a great side to pair with it, like a fruit cup, a side salad, maybe baked potato as opposed to French fries or any other veggies that are on the menu. If we're starting with an appetizer, choose salads, other vegetables, roasted Brussels sprouts is a popular one at a lot of American restaurants, or maybe a broth-based soup. And then lastly, skip the extras. If they offer you dessert, maybe to supersize your meal or choose a large, I try to avoid doing so. Okay, so we've talked a whole lot about the calories in. I'm going to talk briefly about the calories out. So physical activity. Now, physical activity is recommended for cancer survivors as well. We do see a link with higher rates of physical activity and lower rates of cancer. We do, in a perfect world, recommend a mix of aerobic, aka kind of cardio activity, and resistance activity. It's recommended that we average 30 minutes for 5 days a week, or 150 minutes a week total of aerobic activity. This is things like walking, jogging, running, maybe swimming, cycling, or also more sports-based activities like playing tennis or pickleball, things like that. With resistance exercise, we recommend twice a week, ideally on non-consecutive days to give your muscles a day of rest. And this is things where you're really focusing on muscle building. Weightlifting, whether it's machine or free weights, Pilates, resistance bands, bar class, or body weight exercise and calisthenics are all great options. At the end of the day, what matters most is that you find activity that makes you feel good and that you'll stick to doing. So find something that you enjoy. And the cancer support community does a great job of offering options. Whether you need to start really low intensity, maybe we're starting with chair exercises, maybe we want to do dance class, maybe we want to do Pilates from the comfort of our home. There's lots of great options to get you started. So some tips to help all of this stick. We want to make sure that we're setting really realistic goals. This also starts with being really specific. So instead of a general goal of, I want to lose weight, maybe we set a specific range that's appropriate. And this is maybe something that is helpful to speak with a doctor or a dietitian about what's actually appropriate. We don't recommend aiming for more than 2 pounds of weight loss a week. And 2 pounds is kind of on the higher end. You really have to have a lot of excess body fat or have had a really high calorie intake in order to successfully lose 2 pounds a week. So a more realistic goal is maybe I will lose half a pound a week. You also want to be time oriented. It's helpful to have a goal in terms of the time frame. Maybe there's a special event 6 months from now. That's great motivation or a good marker for you. So now we might say, I want to lose 10 pounds in 3 months. Make sure you're thinking about your lifestyle. You want your goals and your outcomes to align with your lifestyle. You may know that you're in a really busy season. Maybe you're working really long hours. Maybe your kids have really crazy schedules. Maybe you're being a caretaker right now. Then you might want to adjust the time frame based on the reality of your lifestyle. Also, factor in some flexibility here. Life is going to interfere. We don't expect a perfect day every day. We don't expect a perfect meal, a perfect workout every single day. But what really helps is consistency. So if you have a special event, maybe you're celebrating a birthday, anniversary, retirement, or maybe you're just hanging out with your friends on the weekend and you end up overeating and not moving as much because it's cold, it's rainy. That's okay, enjoy, but make sure that we're setting our other, components of our week or maybe our day up to support our goals. So, for example, if we know we're eating out for dinner, then maybe we make sure we have a really nutrient-dense breakfast and lunch and factor in some physical activity. Setting realistic goals can also make sure you're prioritizing your mental health in addition to your physical health. When we put a lot of pressure on weight loss, that can take a big mental toll. So we want to make sure that this journey is something that is, again, sustainable and also fulfilling. So to wrap up here on the big picture of things, What we want to do is choose portion-controlled, nutrient-rich foods and aim for at least 150 minutes of physical activity a week. So this kind of sums it up. We can tweak, we can get really specific, we can experiment for you. But at the end of the day, no matter how much we're eating, if we're not eating nutrient-dense foods, we're not going to feel great. And if we're not moving our body, we also might not feel as great. Um, we also recommend doing this to improve energy. So making sure you're not under eating, especially if you're in early days after cancer treatment. Getting that fuel in will help to support energy levels and decrease your chance of additional health problems. So I am a Northside dietitian, so I have included some resources if you're a Northside patient and you're looking for more guidance for weight management. If you're a survivor and you were treated at Northside, you do have the option to work with our survivorship dietitian, which is me, um, to address your weight management goals. If you're not a Northside survivor or oncology patient, you can always reach out to Northside's general outpatient nutrition department and set an appointment with them. You might need a doctor's referral for this. And they do offer in-person appointments, I believe telehealth as well. And we have our dietitians at Atlanta, Forsyth, and Cherokee. So I've included our contact number and email below if this is something you're interested in. You can give us a call or shoot them an email to help get you started. And if you're not a Northside patient, almost all the main cancer institutes in Atlanta are going to have dietitians available to you or some kind of nutrition support.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.